Non-surgical facelifts are taking off in terms of popularity. The question you should be asking is, are they worth it? And in today's episode of the Trillium Show, we're going to go over all of that, what they are, and whether they're worth spending your hard-earned money on. So welcome to the Trillium Show. I am your host, Dr. Jason Hall, author of the book, The Art of Aging. It is all about non-surgical treatments. Pick up a copy. I'll put the link down in the show notes. One click and you're there. So non-surgical facelifts are really gaining popular. They've been popular for a long time, but more and more people are talking about them, more and more people are asking about it. And if you look on social media, you see non-surgical facelifts sold all over the place. Seems like every spa and surgeon on the planet is trying to market some sort of non-surgical facelift. The question that you need to ask before going down that road and spending money on any of these non-surgical treatments is, are they worth it? And really, the key in any of this stuff is knowing what you're treating before you go in to have any treatment done. There are countless different non-surgical options out there, from fillers to thread lifts, to laser, to radiofrequency, to traditional microneedling, to ultrasound, and all sorts of different things in between that are marketed as non-surgical facelifts, sort of the office facelift. And all of them work differently, and none of them really address the underlying causes of what you're seeing in the mirror. If you look back at one of my previous podcasts, I talk about the four components of facial aging. And you can, I'll go into a brief description of those here. The four components are skin changes, volume loss, motion, and gravity. And we don't have a treatment option, including surgery, that treats all four of those things at the same time. So before you go out and attempt one of these non-surgical treatments, it's really important that you and whoever it is that you're seeing really sit down and go through a thorough consultation and define exactly what it is that you're looking to achieve and come up with a reason why you're seeing what you're seeing in the mirror. Are we looking at skin wrinkles, things that are the result of skin thinning and sun damage, things like pigment, things like crepey texture? Are we looking at volume loss, so hollowing around the eyes and the temples, around the lower part of the mouth? Are we looking at motion lines, so the crow's feet, the 11 lines, things that Jeuveau and Dysport and Botox all treat? Or are we looking at changes that are the result of a long lifetime spent living under Earth's gravity? So jowls, sagging of the neck, sagging of the eyebrows. Because while there are non-surgical treatments that can help to some degree or another each one of those four components, if you go in and are looking for a skin treatment to take care of your jowls, chances of you getting a good result are pretty slim. Same way, if you're looking for a surgical treatment, so a treatment to reverse gravity changes to affect your skin, you're also going to be disappointed. And so I can't stress enough, and I spend a number of chapters in the book talking about the importance of getting an accurate diagnosis before you actually go in and have anything done. What are the pros and cons of some of these non-surgical treatments? And we'll break down a couple of them. First is things like laser. So lasers typically work, and I did another podcast about those, about the different types of lasers. Lasers can be broken into two categories: ablative lasers, which are, think of it as polishing the surface of your skin, or non-ablative lasers, which are heating the undersurface of your skin to try and build some collagen. Those two treatments work really well, but are mostly aimed at treating skin damage. So we're treating skin lines and wrinkles. We're treating or attempting to treat collagen loss. There are better treatments than non-ablative lasers to improve collagen in your skin. We'll talk about that in a second. But lasers really target the skin. So if you're looking for a laser to reverse jowls or saggy neck or saggy eyebrows, for example, you're going to be disappointed. But they work really well for changes in your aging changes in your skin. The second thing that we can talk about are thread lifts. And I've kind of gone on record a number of times saying I think thread lifts are basically worthless. They are sutures, dissolving sutures that we use in surgery all the time that somebody puts in with a needle in kind of underneath your skin, trying to lift things and hold them in position. They work great for a week or two, and then they're largely gone. So I don't really recommend thread lifts for anybody unless you have a couple $1,000s to spend and you want to look good in a week or two for an event. Other than that, they're pretty much worthless in terms of a long-term anti-aging treatment. A third thing that we can talk about is radiofrequency. And I think radiofrequency microneedling, so I use the Genius RF device. There's a number of them out there. Morpheus has made a big name for itself. It's kind of the one that everybody, it's kind of the Coke of RF devices. Radiofrequency devices are really good, again, at skin treatments. The idea with radiofrequency is that we target the deep layer of your skin where the collagen lives, and we apply some energy into that layer to stimulate your body to grow more collagen, so to thicken the layer of skin that thins with time. It is a great treatment for skin rejuvenation. You will get a little bit of tightening of the skin over time, and it's a good treatment. You know, I use it for not only before surgery, but I use it for patients who have a little bit of crepey texture under their neck or along their jawline after surgery to help firm that area up and thicken that skin. So RF is a great treatment. It isn't a facelift though. The last thing that we can talk about in terms of non-surgical facelifts is fillers. And I'm a surgeon. I do a lot of facial cosmetic surgery, and I don't hate fillers. I think fillers very definitely have a place in an anti-aging plan, but they're not everything they're cracked up to be. With fillers, obviously, we are replacing volume that is lost over time. The problem is as those volume changes, those areas of volume loss progress, we get to a point where filler either isn't look natural, or you need so much filler to replace the volume that you've lost that the economy of the thing just doesn't work out. And unfortunately, you see a lot of bad filler results. You probably see a lot more good filler results than you know, because they're done well. They're done tastefully, they're not overdone, and you see people walking around that just look good that have a syringe or two of filler. The ones that make the news, the ones that show up on the tabloids, the ones that catch your eye at the grocery store are the ones that are done poorly, where injectors try and add a lot of volume along the cheeks, they try and add a lot of volume along the jawline to kind of compensate for gravity changes, and they end up overfilling things and making people just look odd. And so, is filler a good non-surgical facelift? Absolutely not. Is it a good adjunct to other things to replace volume loss? Yes, especially in patients who are in their 20s, 30s, and 40s. But you know, once you get more advanced signs of aging, we need to talk about filler as a part of another treatment, or switch gears and use your own body fat as a filler, which is much more long-lasting, has a much more natural looking result. But volume addition by itself isn't a good non-surgical facelift. Volume by itself just is not the end-all be-all of non-surgical facial rejuvenation. It's a great part, but like radiofrequency, like laser, it is a part, not a treatment by itself. Because if go back to the 4 components of aging, each one of those are really, the laser, the RF are only treating the skin. Volume is corrected with fillers. Motion is corrected with things like Botox, Jeuveau, Dysport. And gravity, unfortunately, is really best treated with surgical treatments, things like a deep plane facelift, brow lift, neck lift, things like that. I think the thing to remember is when you're shopping around for non-surgical facial rejuvenation treatments, that the diagnosis part of the treatment, when you're shopping around for non-surgical facial rejuvenation, diagnosis always comes before treatment, and you have to have an accurate, thorough diagnosis and somebody laying out an entire treatment plan so that you can make sure that you're not throwing money away on things that were never going to work in the first place. That's why I wrote the book on non-surgical facial treatments, to kind of give you an insight into that. If you're interested, click the link below. You can get a copy on Amazon. But I hope you found this podcast interesting, entertaining, and informative. If you have any ideas or questions, shoot me a DM. Email me at info@drjasonhall.com. We'll see you on the next show.